So I'm going to start off by telling you all that I am the mother of 4 children. I had 1 hospital birth and 3 home births with an independent midwife after the hospital birth wasn't the kind of birth that I would have desired. So I ended up giving birth at home for the remaining 3. And after the second birth, I was so empowered by that birth in 2000 that I set up a home birth support group from my home with my husband. And through that, decided to become a part of the Maternity Services Liaison Committee, which most of you will now know as Maternity Voices Partnership. But in those days, 25 years ago, it was called the Maternity Services Liaison Committee. And I became chair of that for about 15 years. I also worked with Barbara Kuipers. I don't know if any of you have ever heard of her. She was the local midwifery supervising officer, something like that. And she helped to recruit supervisors of midwives, both local and national. And so I used to do a lot of work speaking for the LSA and also interviewing midwives with her as part of a panel. It was an amazing role, and I had such a great time sort of going around the country talking about the role of a doula. But as you all know, unfortunately, supervisors were scrapped, and that was lost to part of my role. Over the time, I became an antenatal and postpartum educator, and that really opened my eyes in a very different way to what I was able to teach couples antenatally, particularly because as a doula I had been witnessing births in the birth room, but I wasn't actually aware of the level of education they were receiving prior to their birth experiences. I spoke at universities and conferences, all different. So I spoke to a lot of student midwives in universities within the area. And because of my experience, when lockdown came, I decided to write a book. So from March 2020 to the October, when my book was published, the first one, which is called Labour of Love, The Ultimate Guide to Being a Birth Partner, it was very much aimed at the idea that the one person that was so underprepared in that birth experience was the birth partner. The woman seemed to know what she was doing, the midwives knew what they were doing, but the birth partner really floundered. And so I really wanted to invest my time in preparing a fantastic resource for them. And not only them, but maybe, it wasn't a man that was going into that space. Maybe it was a female partner. Maybe it was a mother, a sister, a cousin, a friend. And so I wrote a book that was aimed at anyone supporting a woman within her journey from pregnancy through into the birth experience and beyond. In 2022, I wrote my second book, which is called The Art of Giving Birth, 5 Key Physiological Principles, because over the last 20 something years of being a doula, I witness physiological birth all the time. And we've obviously changed the name. It used to be called normal birth or natural birth. And now it's very much called physiological when something is, left to develop in its own way. And so I wanted to give back, again, my experience of supporting physiological birth. And so The Art of Giving Birth was my second book. I've also set up a podcast with over 150 episodes now. The last one of this season is going out on Sunday, and you might be interested to know it's with Dr. Rachel Reed, and it's about meconium-stained amniotic fluid. So it's very much an interesting topic for many midwives and anyone in the birth world to listen to. I'm over on social media on Instagram at The Ultimate Birth Partner is my name. If you want to look me up, please do. I would love to see you over there. I feel like Instagram is a great way for anyone in the birth world to support women wherever they can, to learn more about their bodies, about their options, and everything really about antenatal education where possible. So why do women hire doulas? This is something that obviously a lot of people wonder. That's because they can choose them, they can handpick them. When they do, they start to develop a relationship with their doula. They have antenatal preparation sessions, they really get to know them. And then, of course, once they've really gone into the information that they want to share with their doula and written a birth plan and really considered their options, on the day, the familiar face that they've gotten to know and gotten to sort of really build that relationship with arrives, and you can see a woman's shoulders drop, her face softens, she starts to feel like, okay, I've got my support network around me. Her partner's got the ability to look across the room to the doula and see that the doula's calm and relaxed, so everything must be going well. And that continuous support goes on throughout the entire experience. We know from evidence that it increases mobility, having a doula increases self-belief, decreases pain, anxiety, often leading to the decreased use of epidurals, shorter labour, higher satisfaction rates, very little need for extra interventions, better infant outcomes, fewer C-sections, and typically spontaneous vaginal birth, depending on what the woman wants, how she's been able to advocate for herself, and if everything has gone to plan. But we do also know that even if things don't go to plan, the women's satisfaction rates typically tend to be higher because they felt very well supported by the birth team that they have around them. We offer one-to-one personalised care. We have 24-hour availability. We are that familiar face, and we can offer continuity and reassurance. Again, the support for partners, knowing that they know you, they've spoken to you about their deepest fears, they've talked to you through the things that you are expecting from them or their partner expects from them. And we obviously, vast majority, I would say, of most of our clients typically have high risk or are outside of guidance. These are the VBACers. They are women who are possibly have high BMI, but they want to use the birth centre. They are women who have had usually traumatic births in the past, and then they've got no family members close by, or in some cases, their partner can't actually be with them, which is another reason why hiring a professional birth doula to be with you can be a really good choice. Me, myself, I provide emotional support, as you can imagine, being able to really understand that woman, what she's told me. She might be an abuse survivor. She might have got problems within her own marriage. There may be all sorts of reasons that she's spoken to me as her doula and, given me access to information about what she needs in those moments, in those hours, in those days, in some cases of her birth. We can, or I can, encourage the use of comfort measures, breathing, relaxation, movement, positioning. I know that's not different to a midwife, but we get in there before. We're typically arriving at the home. We're usually involved in some form of transfer, if it is a hospital birth versus a home birth, and all of those things are taking place in the hours and moments before medical care is required. And so, I would say I adopt a less is more philosophy. So I don't encourage anything unless the woman looks me in the eye and says, I'm not comfortable, Sallyann, can you help me? And then I'll go, of course. If she forgets to breathe, I'm there to remind her. There's, very much the wiping of the brow, the feeding of the snacks and the drinks, very little talking, very little doing, just being present, being in the room. And then if things do go off-piste, plan A becomes plan B, then I am there to offer explanations, to ask questions of care providers if she doesn't have the voice or the capacity. Maybe the partner has said, please, can you speak to them for me? And then ask questions on my behalf. It's an interesting dynamic with regards to where's a doula's place in this scenario. And what you have to remember is I would never give advice or make decisions, but I am there bridging the gap between the couple and the care provider in some cases where that becomes necessary. I also continuously reassure and comfort the mother in general, encourage her to communicate her needs and desires. I'm not there to rescue her. I am there to walk alongside her and step up if she's asked me to, but only if and when that becomes necessary. And of course, assisting her partner to support the labour, showing him ways to touch her, to provide care and support. And that is often one of the things that I think the couples get the most out of is that the partner gets the support from the doula way more than the woman ever does, because actually the woman is in it, it is happening to her, and she doesn't necessarily need anyone to do anything, but they are like rabbits in headlights and often feel like they are floundering. And so one of my sayings is a birth partner can literally make or break the birth experience, especially when it comes to physiological birth, because if the partner is filled with adrenaline, very, very scared and frightened, and unable to understand what's going on, actually labor can be longer, more difficult, more painful for her, and they don't always understand the reasons why that happened. So let's go through some case studies. This is Jenny. She is a client that I had many years ago, and her husband walked out on her during the pregnancy. She was living in Kent. Her parents lived in Warwickshire, and she literally had no idea if her husband would be at the birth, but she knew from the outset she did not want her mum. So her only option was to hire someone to attend the birth with her. And we obviously became very close during the process. You might be interested to know that her husband did come to the birth. He never took his coat off the whole time. He was not a very pleasant person to have around. And unfortunately, she gave him that opportunity so that he would meet their baby. But it wasn't a good plan in the end, because actually he disrupted the whole thing. And had she not had him present, I think it would have been a much nicer experience for her. But that's one of the reasons why Jenny hired a doula, because she really did need a confident, supportive advocate in the event that she had no one else. This is Daniela. She was having her second pregnancy. Her first was a C-section for lack of progress, and she was completely traumatized by this. She was absolutely not happy about the way things went, and she didn't know what to do. Becoming pregnant again was scary for her. It took her 7 years to become pregnant again. She didn't know if she wanted another baby. But when she was pregnant, since the Embrace report and other things, she was told she was high risk because she was Black. And I think that was a bit like a red rag to a bull. She hired a doula. She decided to give birth at home so that she could feel safer and more in control of her environment, what happened to her. And, just in general, she just wanted somebody there to support her in that moment. She was concerned post-COVID that no one would come out on the day, and she had to really fight for the support, but she did eventually receive it. She had an incredible home birth with a fantastic team of midwives who really did support her all the way. It was just unfortunate that during the pregnancy, it did seem like a bit of a battle, but having the support to get through that time, I think really helped her mentally as well as on the day physically. This is Charlotte. I met her when she was pregnant with her third baby. At the time, she didn't know she was pregnant with identical twins. But she wanted a doula because even though she'd successfully had a VBAC with her second baby, it wasn't the birth she'd hoped for. And so as soon as she felt confident that she was, pregnant and everything was going well, she hired me as her doula. And then, of course, at the 12-week scan, found out that she was incredibly high risk, and she was devastated. She really wanted a hands-off birth, and, it was hard for her. But again, she worked really hard and really closely with the hospital, and she did have the most beautiful hypnobirthing vaginal birth with her twins. And she felt, and she tried to express this really clearly to them, and she wanted me to share that she felt strongly that she wanted to achieve a vaginal birth because her main priority was to keep her babies together and have lots of skin to skin and breastfeed. And so for her, that was her ultimate goal. She just wanted to ensure that her babies were able to be on her. She was still breastfeeding her older children. She was a breastfeeding counsellor. She really had got this as her top priority. So sometimes it, isn't vaginal birth that a woman wants. It's the other part that goes with physiological birth sometimes, where, it does mean that her babies wouldn't have to be separated and, removed from her in any way. She wanted them to have the best start she could offer. This is Agnes. Agnes had her first baby in Scotland, and it was a very, very difficult and long birth. When she got pregnant with her second baby, she had no intention of hiring a doula. But as her pregnancy progressed, she decided that she desperately wanted to give birth at home. She was living in Warwickshire by this point. Her husband worked away, and she lost trust in her midwife because of her prior experience, not because her midwife had shown her in any way that she wasn't trustworthy. And when she contacted me and my partner, my doula partner at the time, she had no money to pay us, but she knew that she had to do everything she could. So she borrowed money from all different members of her family to support her, and knew that this was an investment she couldn't afford not to make. And that's really, really important to share that, because, you know, yes, doulas charge money, and we have to earn a living and put food on the table. And so, you know, it wasn't that we would just say, oh, no problem, don't worry, we'll just come along. And, you know, it was a case that we did charge a fee, and she had to work out how to do that. And in Agnes's case, we decided to contact her midwife because we knew that her midwife felt that the relationship was breaking down. And we went and sat in the hospital coffee shop with her midwife and a couple of other colleagues. And they said, we just don't understand what's gone wrong here. We've got her 4-page birth plan up on our wall in the community office, and we've shared it with everybody. And we had a really deep conversation about how a 4-page birth plan is a huge red flag. No woman should be writing 4 sides of A4 paper to explain what they want and need. This woman was deeply traumatized, and she just didn't know how to guarantee that she would be allowed to birth in the way that she wanted to birth. So from that point, from 38 weeks, we had constant contact with the midwives. We worked as a team to support her, and she had a phenomenal birth experience. And she wanted me to share this with you all. As the time of my second birth drew near, I experienced a lot of grief and anger concerning my previous birthing experience. The sense of powerless rage I had about it all was making me anxious about our planned home birth. I did not feel I could trust my midwives to support me in all the possible ways I might need to be supported, and the process could easily be hijacked and I would be whisked to hospital like the last time. So just a few weeks before our given due date, we contacted Sarah and Sallyann. I quickly felt that I could trust either one of them absolutely, and was convinced that they would stand up for me and support me in every way possible, whatever happened during the birthing process. The conversations we had together and the trust and respect they placed in me, as I can't see that all of that, but as the mother, it enabled me to relax in a way I had not felt able to before. I went into full-blown labour very quickly this time, which took me by surprise. By the time our doula came, she was immediately down on all fours to support me physically and emotionally in a contraction. Both the spoken encouragement and the wordless support and love she gave me as it was all happening together with the utter relief I had in her presence were completely invaluable. Sorry, as I say, part of the screen is cut off, so I can't see it all. I hope I got all that wording correct. So as you can see, Agnes's birth was, you know, incredibly empowering for her, because she'd had that extra support just right at the end there. And then the last one, Amelia. Amelia's birth story is the current podcast episode, which went out on Sunday, because Amelia had a high BMI and was also insulin controlled gestational diabetic. And she wanted to give birth on the MLU with her second baby. She had her first baby on the MLU, had a high BMI in those days, but didn't have insulin controlled gestational diabetes. So this time she worked really, really closely with the consultant midwife, and it was agreed with the use of a continuous glucose monitor, which you can see on her arm, that she would be able to be in the water on the birthing center, and she was very, very grateful for that. She desperately wanted the same birth again. She had such a fantastic birth the first time, and she really didn't want to step away from that, you know, experience, that amazing physiological birth. So as I say, the consultant midwife was amazing to support her. There was various meetings to pacify the team, and the baby wasn't playing ball either, because she was often transverse during scans, and that gave everyone very nervous feeling. And they were really keen to get Amelia onto labour ward in case there was a cord prolapse. But eventually, baby went head down. She went into labour, and it all went exactly how she wanted. Amelia wanted me to share with you that the CGM monitor on her arm, she said, I had to fight for this as they did not want me to have it, but it was so useful to demonstrate my usage control, both pre-birth and during. And so if any of you are in a situation where you do have a woman that is desperate for a physiological birth and she wants to use the MLU or birth centre in your area, I would really recommend getting hold of a CGM monitor for that person, because it really does make a huge difference to them, because they have got consistent access to their readings without disrupting the birth. When you're working as a doula, you really hope that everyone participates in a team effort, that the mother and baby are at the centre of the care, and the midwife, doula, partner and doctor all working to support her wishes, her preferences, where possible, according to, how things are progressing. As long as everything is going well, the mother and baby are doing great, then we feel that we're very much part of a team. And we'll do everything in our power to support anyone during that experience, to make sure that the mother and baby are kind of kept out the loop to some extent with regards to conversations. Let's have them out of the room. Let's talk about, things quietly in a way where we're not disrupting the process, because physiological birth is very sensitive. And as I say, the vast majority of my clients, that's their agenda. That's what they want. And so I very much try my hardest to be a good role model, say very little, speak very quietly, and support the woman in everything by adhering to her birth plan, her preferences, and, making sure that anyone that comes into that space is also doing the same. I very much encourage personalised care plans in every trust I work in, and I cover quite a broad area over 3 counties, Warwickshire, West Midlands and Worcestershire. I would encourage every single one of my clients to access personalised care plans, particularly if they've ticked a box and are high risk. I myself provide trauma-informed care and like to, discover who can support them if they are traumatized. However, I believe everyone should be treated as if they have had some previous trauma, because you never know what's gone on in someone's life in the past. I like to offer true informed consent, and I really find it's important for midwives to understand that when my clients are sat in front of a consultant midwife, a head of midwifery, or whomever it is that they're sitting with, that they recognize these women are having conversations with them without me present. I'm not there pushing them into making decisions about certain things. These women are completely standing in their power, making decisions and discussions about what it is they want. And so I don't want women to be infantilized by anyone assuming that I am manipulating her or giving her advice. So it's really important that I get my local midwives who support my clients to document these are the woman's preferences. They are coming out of her mouth. This is what she wants. She's told us specifically if she doesn't want vaginal examinations, if she doesn't want continuous monitoring, if she doesn't want to be on labour ward, even though she's got a high BMI and she's got gestational diabetes. It's important that these things are documented, that the doula is not the one giving advice. It's very much coming from the woman. And then on the day, we can trust her instincts and recognise that she has complete bodily autonomy. This is the name of my podcast, the Ultimate Birth Partner Podcast. I would love for you to have a listen. These are my books, The Art of Giving Birth, 5 Key Physiological Principles, and Labour of Love, The Ultimate Guide to Being a Birth Partner. You can follow me on Instagram at The Ultimate Birth Partner, and you can check out my website. And if you've got any questions, I will be looking forward to answering them. And I hope I haven't gone too far over.